Good morning. Steve Stites here at the University of Kansas Health System Dolph Simons Family Studio. We are broadcasting live. Welcome back to our presentation this morning. I am joined by my colleague on the right, Hawkeye, not Pierce, Dr. Dana Hawkinson, our Medical Director of Infection Control and Prevention, and colleague who's been on this with me all along. On the left is Jessica Callender-Rich. I've known Jessica for a long time. She is an outstanding physician, an internal medicine physician, who's also a geriatrician, and is one of our great docs who works in nursing homes here in our area. She's also on the Wyandotte County Task Force for Long-Term Care Facilities. And we welcome back Senator Jerry Moran. Senator Moran, are you in your basement again this morning?
Doctor, you know me so well.
Well, some are on national television. Some are TV and movie stars on your program.
Yep. I'm
still in my basement.
Excellent. Well, we know your wife, and again, we know how bright she is, and she's probably got you where you belong, I guess. I mean, that's all I can assume.
I need Hawkeye's press secretary.
You do.
We've got
and then
great
you could
ones
be
here.
then you could be with Jimmy Kimmel or whatever last weekend. So, well,
Right.
So Senator, how are things going out there? And talk to us about what are current thoughts? How are things going in Washington or in your basement?
Well, thank you for the opportunity to join you again and to learn from you all as Kansans do as well. I am pleased with we were together a week ago on this program, and things have happened since then, including Congress passing a replenishment of the PPP fund. That is the program in which the SBA guarantees loans to small businesses that are less than 500 people. And in Kansas, prior to this replenishment of the funds, Kansans had received $4.28 billion in nearly 27,000 loans, and the statistics indicate that has kept 427,000 jobs in our state. It was utilized quickly. The money disappeared I shouldn't say it that way. The money was utilized very rapidly, and the funds were depleted. Congress responded, and House passed yesterday this legislation that adds $310 billion into this account. While we're often mostly focused on health care on this program, and this is generally seen as a jobs or economic aspect of COVID-19 response, it also has the benefit of allowing people to retain their jobs, earn wages, even though they may be at home and not necessarily working, affected by COVID. It is designed, certainly in large part, to make certain that employers and employees retain that relationship and wages and salaries continue to be paid. But the health care benefit is, as we have isolated, it has allowed people not to have to be at work to gain that wage. And so that program continues. A couple of other things related to that legislation that has passed that are directly related to health care, $75 billion more dollars going to hospitals, and another $25 billion directed toward testing. And testing has become certainly a conversation when I'm on this program, but a conversation with me and Kansans across the state. Healthcare and citizens are interested in why we're not doing more testing. And a piece of good news that comes from this legislation is that $21 million is immediately available to Kansas to increase testing to accomplish the goal of broader testing in Kansas. So all in all, what legislation has passed, I think, will be beneficial to Kansans. And I guess I would say the issue that I am focused on, let me go back to hospitals. This week also, the HHS, the Department of Health and Human Services, provided the second tranche of money out of the original $100 billion. The $100 billion that's now been enhanced by another $75 billion to our hospitals. And this time, unlike the last payment, which occurred a couple weeks ago, this payment is based more on Medicaid reimbursement than Medicare reimbursement. So while it probably will benefit all hospitals, it will benefit hospitals that are intensively taking care of a Medicaid population. And that will benefit hospitals that didn't receive quite as much benefit in the last round. So money is coming to hospitals across Kansas and Missouri, and more money has been allocated for that program in the future. My focus for the last number of weeks, but certainly intensified this week, is this PPP program, in my view, ought to be available to all hospitals. And unfortunately, the hospitals that are county, city, or district have been excluded. And even as late as 10 o'clock last night, I'm still lobbying the Department of Treasury, and conversations, at least by text this morning at 5 a.m. on this topic. So we continue the battle to make sure that some hospitals are not left out of being able to continue to pay their employees just because they happen to be organized in a way that makes that they are a county, city, or district hospital. So healthcare is still front and center in the legislative world as well as the healthcare world.
Thank you. And Senator, thank you again for your support. And it sounds like your normal sleep schedule, as I remember, about 4 or 5 hours, is probably down to 2 or 3 hours.
This is, like I say, when we were on this program together a week ago,
yeah.
and I looked at my calendar thinking, that wasn't a week ago. It's hard to know.
It was yesterday, right? It was yesterday.
It seemed like yesterday. So,
yeah.
Yes, but man, I deserve none of that if that's an accolade. When the doctor says you're not sleeping, I'm not sure that's a compliment, but it may be a concern.
Well, we know how hard you work. Let's say that. We appreciate that.
I would highlight how folks at the University of Kansas Health System and hospitals and clinics and public health departments and emergency preparedness are all working around the clock.
Yeah, thank you. Dana, we know that people are working hard, and we're working hard to make sure our patients stay safe, our teams stay safe. Yeah. We've got some decent news this morning, though, in terms of census. It still stays, lower than we were around COVID-19.
Yeah, I mean, we have certainly individual decent news. We have one of our patients who was extubated by our critical care teams a couple days ago, moved off of the ICU yesterday, and so I think we are having recovering patients, but our total census continues to be about flat, which is good. We are cautiously optimistic. The things that we've been doing these last 4 weeks, I think, are paying off. We have 24 patients in-house. We have 11 of those patients in the ICU, so if we continue to do well, hopefully we can continue to see less hospitalizations and less critical illness.
And just to say hats off to the Kansas City area, to Kansas, because we've done a really good job of flattening that curve, I think. But as society opens that back up again, our next big challenge is to keep it that way. Yeah. We don't want another wave. We don't want a lot of surge. And that's going to be about individual personal responsibility.
Yes.
Even as you leave your house to go do more stuff, make sure that 6 feet of distance between you and the next person is part of the stuff you do. And if you're sick, don't go out. I mean, I just can't emphasize that enough, because we know if we don't do that, there's some really vulnerable populations, Jessica, and a lot of those are in nursing homes. Talk to us a little bit about some of the impacts you've seen and witnessed in some of the nursing homes in our area.
Nursing homes are really made up of the most vulnerable population. They're frail, older adults, and they're living in these congregate settings because they need the extra help. And needing that extra help means that they're probably also at higher risk of any illness that's out there. This one is not any exception. So we have seen a lot of efforts across the country and locally to really ramp up the ways in which we protect our patients and residents that are living in those nursing homes, whether they're there because they live there or they're there because they needed additional help after a hospitalization. And we are really working hard to provide them the therapy and the things that they need, in addition to using a lot of personal protective equipment that we don't always utilize because it's not always indicated. That also means that those patients and residents are more isolated than normal. We know that across every healthcare setting, and nursing homes are no exception, we're not able really to allow anyone in the building who's not absolutely essential to the care of that person. So that means that these people are really without interactions that are so necessary with their family and their loved ones. A lot of things have happened around the community to try to improve that. Really creative things have happened, including teaching people who are not usually used to using a lot of technology how to use iPads and FaceTime, which has been a really interesting experience. Other things that are being done in the community are really standing up task forces and programming to try to develop ways that we can consolidate the care of those patients in the most safe way. So we have recently stood up a task force in Wyandotte County that I'm part of in order to develop guidelines and to take the guidance from the national organizations at the level of CDC and CMS and really create a consolidated set of documents that can help each facility adapt their own policies and create ways that are evidence-based on whatever evidence that we currently have to protect those folks.
Thank you. And you know, that iPad in the elderly is important. My mother-in-law is 87 years old. She rocks, and she's Zooming. I mean, you know, it's pretty impressive the things that are going on out there. Well, let's turn over to our media friends and ask what questions they may have for any of our guests today, or for Senator Moran. And I have a few too. So, what do y'all have today?
Hi, this is
Good morning.
How are you? A lot of folks.
Okay, somebody. One.
This is Brian Lowry of the Kansas City Star
Hi, Brian.
Center. Thank you for doing these weekly calls. We really appreciate it. My question is about testing. You mentioned that the bill that is now on its way to the president's desk has $21 million that can be used right away by Kansas. Do you have a sense about how many test kits $21 million produces, and in terms of like what level of an increase that will be to the state's overall testing capacity?
Brian, while I don't have an answer specifically to your question, and maybe others on the program can calculate how many tests you can buy, test kits you can buy for that circumstance, I would say that with the goal of broad testing, this is still, in my view, probably insufficient. I don't know that I need the word probably. Is insufficient. More testing than this will account for is required. And I also would say that while money is helpful, and there's lots of demands on the state of Kansas, on our county health department, and on the Kansas Department of Health and Environment, money is beneficial. If you can't get the tests, money doesn't solve the problem. And there's still the challenge. And I spent an hour and a half yesterday with Zooming with 14 hospital administrators from across Kansas, having a conversation about what stage they're in beginning to open up to take patients, and when can that happen. And without exception, the issue is we need testing in order to satisfy ourselves. We need to be able to test every patient that we're going to perform a procedure on or who's going to be visiting our hospital. And we also need a laboratory that can turn the result of that test around in a matter of moments or hours. You cannot test a patient who's preparing for surgery, send the test off to some place that takes a couple of days for the results, and then ask the patient to come back in to have the surgery. It needs to be the immediate result. So we still have a long way to go, even with this plus up of money. And while $21 million is coming to the state of Kansas, there is a significant amount of money in the bill beyond that, $25 billion in total, and 14 of that is to do research to get us to the point in which we have the test and the vaccine that could replace the necessity of testing over time. So maybe my colleagues, I shouldn't say it that way, maybe the experts, the physicians on the program have a sense of how that money could be spent, how quickly, what it would matter, but it will be granted through a program that exists, which has been Congress's effort to not create something new that we have to figure out how to utilize, but through PEP grants through CDC, which our state is accustomed to and receives on an ongoing basis anyway. And my goal, which I have not succeeded at, Brian, is to try to determine why Kansas is so low on the list of states in testing now. I understand why it would be true when it comes to hotspots in a comparison to hotspots in the country. But is there something that I can do to be helpful to get us, how can we help the state of Kansas, I guess is the way of saying that, to get us where we're doing more testing in relationship to our surrounding states and states like Kansas with the level of prevalence of COVID-19 that we and they have together.
Brian, I'll take a swing and a miss at this question. Here's the swing, and then I'll tell you why it's a miss. So a lot of us have ramped up. I think we're up to about 500 tests a day. We're trying to test as we think about opening up to more surgeries. We're thinking, gosh, how we're going to have to test all of our patients, and then we're trying to provide tests for counties that don't have enough tests on both in Kansas and a few in Missouri. And as we do that, we open up. We do it with Vibrant, the FQHC here in Wyandotte County with first responders. We're trying to get all the tests we can out into the public, as long as we've taken care of our patients and the folks we need to take care of here, our staff and our community. As we do that and as more tests become available, it is critically important, as the Senator has said, to have those as we open up society. And the reason is that as you open up society, if somebody gets sick, you got to find out right away if they have COVID-19, so you can trace all the people they've been in contact with, notify them, and get them to all shelter back in place. And that's really important. A week ago, 2 weeks ago, if you looked at the Kansas map, and most of the cases were in Kansas City, Wichita, Topeka. But now if you look at the Kansas map, there's hot spots all around the state. The meatpacking plants are a good example of that. And what it really tells us is an important story. The story is that where people are congregated together, and it doesn't have to be work. It can be social occasions. It can be anything where you're congregated together in close quarters. If one person gets sick, a whole bunch of people get sick. Because that's really the story. It's not that meatpacking plants are evil. It's that if you put people in close quarters, and if one person gets sick, a lot of people get sick, and the only way you can intervene with that is to do testing early and often. And so that's what this money has to go for. I don't know exactly how far it'll go. I know that Lee Norman might have a better answer to that as the head of KDHE. What I know is this, though. There are people all around the state stepping up to help do contact tracing. For example, Dr. Norman has said they wanted 400 more folks to do contact tracing in the state of Kansas. Well, our census is down because we quit doing elective surgeries. We quit doing ambulatory care visits as much. And as a result, we have people who are available to work. So I think we volunteered 50 folks to go over to help KDHE. The School of Medicine has taken fourth-year medical students who are graduating early and going over to do things like contact tracing, but also to go help physicians and hospitals where there's need to provide more support personnel out there, whether that's contact tracing or trying to help work in an office or whatever it may be. So there are a lot of people directed at this. How far will 21 million go? I think I share the Senator's concern. It's a big help. Not going to go far enough. We have more work to do, and that's going to have to be a combination of not only federal but state, local, and individual resources as people try to volunteer and help us do things. Next question.
And then related to that, for both Dr. Stites and Senator Moran, is it appears that Kansas is likely to open up before we have the really broad population testing that is ideal. Obviously, it sounds like health centers will be testing all the patients that they have coming through. But as I know, Dr. Norman has talked about that an ideal situation would be you'd be testing much more broadly in the general public. It sounds like Kansas is going to likely open up before we get to the point where we can test like that. And what I would like to know is whether that's a concern and what we can do to mitigate that.
Yeah, let me answer that, Brian, but then I'm going to move to the next reporter. So I think the answer is that that's true in 50 out of 50 states. It is true in Kansas. But here's what we know. And then, and Senator, I'm sorry I jumped on this one, but we know that social distancing has worked. We know that we have an advantage because we're less dense in terms of population. Kansas City is like 1,400 per square mile, and it goes down throughout Kansas. And if you look at New York, it's 25,000 or 30,000 per square mile. If you look at Manhattan, it's almost 100,000 people per square mile. And we know that in our area, our curve is a lot lower than what it was in New York State. And we know that that is an impact because folks have acted very responsibly, and we have an inherent built-in advantage with our population density. So as we open up, while testing is critically important, personal social responsibility has never been more important. Because you can shelter at home, which is a great way to achieve social distancing, but you can socially distance at work. And as you look at the plans coming out of state governments, including ours, what you see is even at work, they're saying social distancing. They're saying when you go into a store, social distancing. If we can maintain social distancing, that is going to be an enormous help. So, yes, we need more testing, and that, as we say, is a federal, state, local, and health system and everybody's responsibility. But man, social distancing is a personal responsibility, and that's something we're all going to have to be a part of, just as we have been so far, which has bent the darn curve. We got to keep doing that. Senator, I'm sorry. Go ahead.
Good morning. Is the senator going to talk, or can I?
I don't. Senator Moran, did you have anything else that you wanted to add with that?
No, I'm ready for the next question.
All right.
Well, good morning. It's John Pepitone over at Fox 4 News. And in regard to testing, I guess this is more of a question for the docs. Walmart today is rolling out some self-administered tests in our area, and I know you've talked about this before, but I was wondering if the doctors could again talk about the reliability or lack of reliability with self-administered tests. I've heard it described as the nasal swab. You literally got to ram it so far up your nose that you're bumping up against your brain. I don't know if that's true, but if you can describe how to do a self-administered test properly to get a good sample, I certainly would appreciate that.
All right. So I'm going to turn to Dr. Hawkeye here. Hawk?
Yeah.
Those things scare me. How about you?
Yeah, for sure. You know, we don't know, I don't know what this test is. If it is a nasal swab or a nasopharyngeal swab, that's the gold standard. So that is the one that goes back into almost the brain biopsy. It
feels like
far.
a brain biopsy.
Yeah.
I've had one. And by the way, it's the same swab as you use for influenza, which also feels like a brain biopsy.
Right. But I don't know, they have looked at validating other sources, meaning the nares or the nasal passages, which is not as far and not as deep into your sinuses, or even some saliva or spit test to look for the virus. So I don't know exactly the details of this test, but there are other tests and other methods look at being validated so that you don't have to do it as far back into the nasopharyngeal area. That might be what this is. Again, I think the important thing to know is that there are a lot of companies with really good intentions who want to do this to make this available to the public, but we just have to make sure that the tests are validated, if you get a positive test, it's truly positive. If you get a negative test, it's truly negative. I'm sure and I'm hoping Walmart is vetting and validating those tests as everybody should be. But I think we just kind of have to wait and see. And again, I don't know the details specifically of that.
Yeah, I don't either. I just know that anytime you do something of that has a high fidelity, meaning that you have to really work hard to get the test right,
yep.
That's where you lose sensitivity, is if you don't do the test right, and then you think you're reassured. It makes me a little nervous to be throwing all those kits out there. And remember, anybody who tells you right now that they've got a commercially available, meaning it's going to be at Walmart or anyplace else, good quality IgM or IgD test first antibodies is not telling the truth. So there is some interesting data coming out of New York where they have a really good quality test that was used for research. And I think that's that's the kind of quality we want to look at. And they found that a lot of people are positive, like up to 20% of the population is positive in that sample. So that was a lot higher than I think folks expected.
Yeah.
Next question.
So you would have some concerns about a self-administered test?
I'm nervous about it because, we train people on how to do the swab right. And if you don't do the swab right, then the test isn't right. And if you think and the salival tests are not validated yet. Yeah. And if you just roll it around in the front of your nose, you're not going to get a good result. You got to get back. It's a nasopharyngeal. That means it's in the back of your throat. So it goes through your nose, into the back of your throat. You're twisting it around the whole time. And that's what makes it feel like a brain biopsy. It's going through your nasal passages, and it kind of tickles your spinal cord almost. And that if it doesn't feel that way, then it's not good. And so they've got a lot of them have a little red mark on them. You push it into the red mark, you're twisting it the whole time, then you sit there and you twist it as it comes back out, and then you got to make sure you get it into the medium correctly. And then you got to be able to there's a lot of steps to this to make sure that's right. And if you don't follow those steps and you're not positive, well, I don't know what that means. And that's the struggle.
Yeah, and those NP or nasopharyngeal swabs, they're hard to get them done to you by an accurate tester. I couldn't imagine doing it yourself. So, we do have a history of a very good validated home tests, pregnancy tests, HIV tests, blood glucose monitoring tests. So we do have a history. We just need to make sure this one is accurate and validated.
And I think we don't know that right now. Yeah. Next question.
Question for Dr. Hoskinson.
There are two there at the same time. Is there a question for the senator?
Go ahead.
I have a question for the senator. This is John Riley with the Pittsburgh Morning Sun.
Good morning, John.
With the effort to start to open back up, although it sounds like that might get delayed based off some AP reporting from yesterday, what the governor said. For retail businesses or restaurants and that opening up, even with social distancing and, wiping down tables, social distancing the tables apart and that kind of thing. But how realistic is it for businesses, small businesses, to even be able to do that with the unemployment extra $600? I mean, it sounds like that's going to be more than people were getting paid in a lot of cases, and they're kind of more incentivized to stay on unemployment right now versus like what a lot of small business owners are be able to pay them.
John,
how's that going to affect the economy opening up?
John, thanks for the question. Thanks for covering this topic for your readers. First of all, decisions about opening up, in my view, need to be done in a very decentralized way, meaning that decisions made closer to home, closer to the facts, utilizing the expertise of local experts is important. And as has been said, I would say that Kansas is different than New York. That's an obvious fact. But also places in Kansas are different one from another. So decisions about when and how to open up are to be made in a way that makes sense for people's health. You do raise a point that the policy that was adopted in the CARES Act, what we've been calling Phase 3, increased unemployment benefits for workers by $600 a week for the next 4 months. And there has been legitimate concern that there are income earners who would make more on unemployment than they would if they were working. We tried to correct that. A vote was taken to alter that circumstance. The vote to change that $600 was defeated. So it is what's being done. It is the money that the federal government has paid to the state of Kansas to enhance, has paid money to the state of Kansas for that enhanced benefit. But it does create this disincentive for work if your decision about working is based solely upon income or need for income. So it's a challenge and one that is recognized but has not yet been solved. My hope is that people are anxious for work. Work certainly is important to a family for putting food on the table and caring for themselves and others. It's also a moral component or a part of our soul. Work matters to us as who we are in significance in life. And I hope there's many, many Kansans, I know there are, who will choose work at every opportunity. But you raise a topic, particularly at income or wage levels that are toward the low end of the scale. This has a consequence there more dramatically.
One of the things, Jessica, as we look at opening up society, do you think nursing homes are going to open back up to visitors?
That's a really great question. As I've already stated, that population is just at such high risk of any exposure from outside in the community. And I would suspect and would encourage those facilities to remain closed to outside visitors and open only to essential workers for as long as possible until we really have a handle on the ways in which we can vaccinate and really prevent the spread of COVID-19.
Yeah, I know they are really, that is going to be a big deal. And I think even the health system, as it thinks about opening up a little, is going to have the same, not going to change visitor policy, which is really no visitors. And although at end of life, it gets really hard like that, I think. Any thoughts about that?
It does get really hard, and some of the exceptions that are out in the guidelines that are being followed in long-term care facilities do include exemptions for allowing loved ones into the hospital with really specific protective equipment, both for the residents and for that person that's visiting. But we are able to allow people in to see their loved ones at the end of life in those situations.
Jessica, this is Jerry Moran. I'm very engaged in issues related to Alzheimer's, research for Alzheimer's issues, dementia. One of the things I'm hearing from that community is that the lack of routine, the change in lifestyle for people home with dementia or Alzheimer's is really showing symptoms of deterioration in those individuals. I mean, loved ones are telling me that this stay-at-home order has a consequence on their family member that has Alzheimer's. And is there a medical basis for that being the case? And is there something that I can encourage these families to do to care for their loved ones?
You know, Senator Moran, I think that's a really important point. Patients with dementia, or people with dementia, I should say, have a reliance on that routine and on their interactions in the ways that they normally have them. And we know that anytime we alter those interactions, the same thing happens when we hospitalize people with cognitive impairment. They're at higher risk for decline, for increased confusion, for really changes in their overall function. And the challenge here is we really have to weigh the risks and the benefits of everything that we're doing, because this is the same population that's really at the highest risk of dying from this disease. And so while I would say that, yes, we are increasing their risk of decline, we're also protecting them from an illness that could potentially end their lives. And so we have sought out different ways that we can really try to maintain that structure, but at a distance. So that includes trying to bring in technology in ways that we can. That includes using caregivers that are also following the same guidelines that are being followed in other healthcare settings or even in the person's home, and trying to do social distancing as much as possible. But I will say that risk and benefit balance is really challenging for all of us.
Thank you, Doctor.
Other questions?
Hi, this is Melissa with Channel 41. I have a question. This is bouncing off of what you just said, Jessica. Do you know what type of testing is happening inside of nursing homes, specifically in Wyandotte County? And what are the protocols in place for those nursing home facilities to report back to the county health department about their findings?
Yeah, great question, Jess.
Yep, absolutely. So current state in Wyandotte County, there is testing happening for those patients that are symptomatic for COVID-19. And that is based on both availability of testing supplies, as we've already talked about quite a bit today, and also really having the opportunity to get out there and do those tests. I think we will see that change over time, but the current state is when there are symptoms, we go in and test. And when there is a positive test, and then there is an opportunity to test the entire building. The guidance on that is not fully developed yet, both at the county and at the higher level, but that is where we're going, and that's what we've seen happen in other parts of the country. And I'm sorry, I missed the second part of your question.
Yeah, no problem. We've heard from some family members who felt that they were not informed when some of these clusters have broken out. So I was just wondering if you knew, once someone or a group of people test positive within one of the Wyandotte County assisted living homes or long-term care facilities, what is the requirement or protocol for them to report that information back to the county health department?
Yeah, that's a really great question. So first, I will say that we are really building an airplane as we fly it. And I know people are saying different things like that all around, and this is really different. I also know that because we can't let people into those buildings, they feel really isolated from the knowledge of what's happening inside the facility. And that also, as a family member who has had loved ones in facilities myself, I totally get it. Those facilities are working really hard to communicate in the best ways that they can with each and every family member. Is it perfect? Absolutely not. But they're trying their best. The other piece I will say is they are reporting that information to the county, and the county is working with them to create a strategy that's specific to each facility in order to test, provide supplies, provide support, and really do everything that they can do to help mitigate the spread, prevent the spread, but also treat those residents in the facility as much as we can. We're also having a push to really make sure that conversations are had about what that resident would want in the setting of them getting really sick. You know, I think in many cases our trigger is to send people to the hospital as soon as they're sick. And in some cases, that's exactly the right thing to do. But we need to really know what that person would want. Would they want to go to the hospital if they were sick? Would they want to be on life support? And that information is critical for us to know how we can treat people in the facility and how we can really meet their quality of life goals as best we can.
And Jess, I think every positive test has to go to KDHE, if I remember. So I don't think it matters where you are. I think you'll have to do that.
Yeah, so they do go to the state level also. And now the new reporting requirements also go to CDC directly.
Yep. Next question.
Question for Dr. Hawkinson. On some of the results that are coming back in on testing in the broader population and the numbers of positives, the percentages, epidemiologically, is that about where you would expect, or are those lower figures an indication that maybe some of the people who need the testing aren't getting it?
Yeah, I think it's a combination of both. I think it's broader testing, but also recently, like I mentioned a couple days ago, we had seen Kansas's highest one-day total than we ever had. I think this was Thursday or Wednesday, Dr. Stites. And so,
I think yesterday turned out to be the highest total we've had.
And it's
so
not
far.
necessarily a consequence of increased testing, because I think the percentage is higher. So I think we are just recognizing it more, but it just could be also spreading more epidemiologically as we are moving further in time from our first case until now. And I don't know if you have anything to add to that.
No, I think that's right. I think as we get more tests and people test more and more people are sick, you're going to have more positives. And the good news that the hospitalizations haven't skyrocketed up, which to me says it's been out there in the community, but it's been unrecognized. Because I think if it had been recognized as we're seeing more positive tests, I think it just meant when we were testing a lot of people, we still had a lot of people out there who were sick. Yep. Because otherwise we would start seeing more hospitalizations. And unfortunately, the hospitalization data is 7 to 10 days delayed from testing, because that's about when people get hospitalized. So we really won't know where we are on that curve for another week. Of course, we say that every week, but that's the limitation of not having more testing. So we always have to kind of hurry up and wait. And that's kind of where we are right now with that.
Yep.
So.
But our numbers are going up, and this is why accurate antibody testing is going to be so important, so that we can really determine who has been exposed to the disease. Because once you have exposure, you're going to have mounting antibody response in your body.
And it increasingly it looks like this has been here for, we said, March, and then no, it's February, now it's January, and pretty soon it's going to be December. It's going to be as soon as people were traveling back from Wuhan and had any connection anywhere in this country. Yeah. And that would be true with any hotspot. It doesn't matter that it started in China. It could have started in Fort Scott, Kansas, which some people thought influenza did in 1918. Yeah. So, I mean, it could have been anywhere. But when people start to travel and interconnect, then this will be the result. And our responsibility is to make sure that we stay distanced, because that's the one intervention we know clearly works. Next question. Senator, how much longer do you have today?
I'm fine. 10 more minutes.
Okay. All right.
I have a question for the senator, if I can get it in. Is Senator, the majority leader this week floated the idea of changing federal law to allow states to declare bankruptcy as opposed to bailing out states facing shortfalls. Obviously, Kansas is one of many states that is facing a budgetary shortfall for next fiscal year. Do you have any thoughts on whether it would be better to allow states to declare bankruptcy, or whether there should be more federal aid passed to help states make up their shortfalls, not just the aid for the coronavirus, but also the aid to make up the revenue shortfalls.
Well, I think we have started with aid to states for consequences of the coronavirus, and we're able to help states in ways not only in direct assistance. Kansas has and or will receive, has at least received a part of it. I think they've received their entire $1.25 billion allotment from the federal government. We have compensated both Johnson County and Sedgwick County, our two Kansas counties, with sufficient population to qualify for federal aid. I think the point I would make is that I'm still interested in being helpful to cities and counties in Kansas and across the country to recover from this virus, the consequences, the economic consequences. I think the thing that I would be concerned of, I don't think it's the responsibility of Kansas taxpayers to help states and localities to recover from their ill-advised, poor judgment of spending spending more money than they are capable of affording. And so if we can look at history, I'm interested in trying to take care of recent circumstances. I don't want Kansas taxpayers to be, to use the pejorative word, bailing out states that have had poor fiscal decisions, live beyond their means, and then want somebody else to solve that problem. So I wouldn't say it exactly the way that it's been said in regard to bankruptcy. I also would add that, as I said last week on this program, federal funding, which is really taxpayer dollars or borrowed dollars, is not there ad infinitum. We do not have the ability to continue to spend at the rate we are spending now, more than $3 trillion in response, and that is just a fact. It doesn't work. The best way to get relief to people beyond health care is an economy that is working and that people are back to work and are capable of taking care of themselves and paying taxes. That requires a healthy country to get there, and so the focus on health care is important. But the way I would say this is Kansans should not bail out irresponsible decisions made in the past. I think as a country we still need to be in this together to try to solve the problems caused by COVID.
Next question.
Yes. This is Bob Winter. Regarding the UV light situation, the president made a major announcement today in the press conference about the UV sunlight. What I understand the KU, all masks are treated with UV light. Is this going to be a prevalent thing, or what? Does UV light really kill us from what they say about it? Is that true or not?
Well, I'm not exactly sure what the president said today, Dana, but we can certainly describe what we're doing at KU because we know that we think we have a best practice. And we do have UV light available, but I think we're switching more to hydrogen peroxide because we think that's actually a better and degrades masks less.
Yep. And I think the vaporized hydrogen peroxide will also get all the surfaces. There are UV techniques used for cleaning masks at different institutions. There's also the vaporized hydrogen peroxide.
We use the UV light, and we started with that, and we put the little UV light machines up on different floors, which were our COVID floors, where we cohort, and we still cohort patients. But what we also know is that the UV may degrade the mask a bit more, whereas the vaporized hydrogen peroxide can be done in a much more effective and efficient manner. We've worked with a company here in Kansas City who has been great and volunteered their services. Heartland, help me on the last part of this. Heartland Pathogen, who has done a great job working with us, and what we're doing together is we're putting masks and hanging them, and then they come in and they do the hydrogen peroxide, the vaporized hydrogen peroxide treatment. The masks are labeled, so they go back to the same person. They also have a little sensor on it to make sure we've gotten to that mask, we know that it's safe, and we visually inspect that mask to make sure they're still in good shape and that there's no smudges and smears and things like that. And we think we can reuse masks masks a number of times. The exact date isn't clear. There's a paper that came out at Duke a while back that kind of described this technique and described how much you can reuse, and that's the one we're following. And we try to really adhere to strict infection control processes. But what's happening now is that the elastic bands that hold on the mask to your head will wear out faster than the actual mask itself and the respirator because the vaporized hydrogen peroxide works so well.
Yep.
So any other thing? Anything I missed on that or I messed up?
No, I think as far as our masks and the process that we are doing and we are currently moving to is definitely accurate. Just a little bit of basic science. We understand, we know UV or ultraviolet radiation is very harmful to our DNA, our genome. So this includes anything. This includes viruses, bacteria. This includes our cells. This is the mechanism of skin cancer. So we know that ultimately, yes, UV radiation can kill this virus, can kill a lot of viruses and other pathogens, and that's really the mechanism behind that in a simple basic science interpretation of that.
Stephanie asks, and this may dovetail, do we know how long the droplets hang in the air, even micro droplets?
Do we know how long droplets hang in the air? Okay, Dana.
Another good question. Yeah, the best evidence we have from published articles is certainly an article that was published, about a month ago now.
Yeah.
That was in extreme and very specific laboratory conditions. In general, though, droplets, and we're talking about heavy droplets, we can't see those, and Dr. Stites has kind of gone into that in the past as well. We can't see those, but they're very, very small. They don't hang in the air very long at all. They drop pretty quickly, probably within minutes. And the heavier the droplet, the heavier they fall. There can be some smaller droplets that may hang in the air for several minutes to an hour in general, but for the most part, a cough or sneeze, the heavier droplets are going to fall pretty quickly. And if there's anything...
No, I think that's right. I mean, if you think about a cold winter morning and you watch out and you blow your breath out really hard, it really goes about 3 or 4 feet, so 6 feet's pretty darn safe. And that's because when you breathe out, most of the stuff are droplets that are 5 microns or greater in diameter. But there's so much science around what it really takes to get into your airway and into your lung and to hang in the air, but both based on size, the charge of the particle, and many other different things. So we really believe that it's the larger particles we think that we call droplets that will do it, and these masks protect you. And the N95 respirators that are the ones that have been in such short supply protect you even against the smaller particles from that. So I think that's they all have to be fit tested. I mean, there's just so much work. We could spend an entire day describing this and teaching people what it's about.
But to go to the general public, we were just talking about the size of the particles and the droplets. This is why it is important for the face mask. This is the science behind the face mask and behind the recommendation of protecting other people from yourself, even just with a cloth face mask. We don't use that in the hospital because it's not biomedical grade, but we are trying to protect against the large droplets that may come out when you cough or sneeze.
So I think we probably have time for about one more question, and then we'll ask each of our guests to try and kind of give us some closing thoughts. One last question. Anyone out there?
Yeah, hi. This is Jackson Overstreet with Cake News down in Wichita. I have a question for the senator. Senator Moran, you and a few other senators had sent out a letter to President Trump urging him to eliminate payment limits on CFAP, and I just wanted to hear from you, why you're pushing to eliminate those payment limits, and kind of what are you hearing from Kansas farmers about what they need during this crisis?
Thanks very much. Thanks for paying attention to Kansas agriculture. It's hugely important. I would say that the commodity circumstance, the commodity price circumstance for whatever you raise is a real challenge. Commodity prices are terribly low and have fallen. I am relegated generally to my basement where I have the market reports on television constantly throughout the day, and it is pretty bleak news if you're a farmer. The legislation that CARES Phase 3 provided $19 billion for agriculture support for farmers and ranchers. The unique thing about this legislation is that at the insistence of and efforts of several of us, we were able to include, or insisted be included, that livestock be covered. That's unusual in most farm programs. Normally we're talking about row crops. But the livestock sector in our state is significantly damaged, and it's a huge component of the Kansas economy, not just the Kansas agricultural economy. In significant part, the problem is the packing, the meat processing facilities, not just in our state but across the country, are either closed or operating at a lower pace. and so meat is not being processed, and that means there's a smaller market. It's what we've seen in the oil and gas industry, for example, where you can't sell oil because there's no space in the pipeline, no storage, and if meat is not being processed, it has a certain life in which that has to occur, and if it can't be done, then the cattle become a lot less value, a lot less worth economically. So huge challenges. The payment limitation issue is that normally in a farm program, there is a limit on any one individual per commodity, how much money they can receive. And with the value of cattle and the significant losses, that payment limitation would generally make, for many of Kansas producers, livestock producers, and dairy in our state, would make that a pretty insignificant contribution toward their financial stability, their ability to survive. And it turned out we have nearly 30 senators, both Republicans and Democrats, who've joined us in this. So it's not just a Kansas issue, and in fact, it's not just a livestock issue. It's also a specialty crop and dairy issue, things that are not normally covered in a farm bill. We're trying to make certain they're not one-size solution doesn't fit all problems. But the most critical thing, I think, for us, and as was indicated earlier in this program, trying to get testing, PPE to the facilities that process meat across our state, and make certain that those workers are safe and feel safe to come to work. That would be a big benefit to the Kansas agriculture economy and to our state.
Thank you, Senator. And so let's go ahead and move to our wrap-up. I'm going to first turn to Jess. Any closing thoughts today?
My biggest closing thought is as we move forward and we think about how things look here in the coming weeks and months, we need to really keep in mind how all of this can affect our older adults, both in the facilities and out in the community, and really maintain really good physical distancing with all of the things that we've talked about, but also find ways that we can really provide support for our loved ones, because this has been really hard on them.
Dana.
Yeah, as we move into the weekend, we want to keep Kansas Cityans and Kansans healthy. There's a lot of inaccurate information out there about injection of disinfectant or inhalation of disinfectant. There are other also social media reports about uses of other drugs such as vitamin C and zinc. There have been other social media reports about using, that my mom had alerted me to, about spraying water heated by a hairdryer up your nose. None of these things are validated. They are all inaccurate. They will not help you. They will harm you. You're welcome to take over-the-counter medicines such as vitamin C and zinc, but do it in the recommended doses. If you have questions about these types of things, please contact your physician or go to the CDC website or the local health department website. Because these can be very harmful. We have to remember there are no proven treatments, vaccines, or prophylactic medications against coronavirus, but there is a lot of disinformation and inaccurate information out there, and doing some of these things can certainly cause you harm, and we don't want that. So please remember to just wash your hands, don't touch your face, don't go out if you're sick, and Dr. Stites will have the final words.
Actually, Senator Moran. And then I get a final word.
Doctors, please, Dr. Stites, you have the final word, but thank you for including me in today's program. I am encouraging Kansans. I spend every day reaching out to them. I encourage anybody who has a desire for my help to reach out to me. I would tell you that you all are in the business, you physicians are in the business of giving advice. I'm generally in the business of getting advice. And one of the folks that gave me advice this week told me that when he was mentored, he was told in times of crisis, tell the truth. In times of crisis, have a plan. And in times of crisis, give hope. And I would compliment you and the University of Kansas Health Systems for telling the truth, having a plan, and giving us hope. I appreciate you all.
Thank you very much, Senator, and we appreciate you. We appreciate you being on the program and being willing. We hope to hear you, have you back next week, and it's just been terrific. We appreciate the hard work you do for Kansans every day, for our area, and your support of our efforts here at the health system. On Monday, we welcome our CEO of the health system and the president of our campus, Bob Page and Tammy Peterman, to the program. We'll be talking about what will reopening, or not, this is, we're always open, but what will it look like as we start bringing more patients back, and how can we make sure that our patients and our staff stay safe? I think that'll be a really big topic that'll be coming up, so that'll be an important one. You know, I want to say thank you to our public. You all have done a great job of helping us and in really doing the work of flattening the curve. As Senator said, we can give advice, but we don't have to make sure, we can't know that folks are always compliant. You know, it's like when you give a new script to somebody and what's the normal compliance rate of patients. This is really about 50 or 60%, and I know because I'm one of them. I'm a patient, and that's about my compliance rate. Don't do that. Be 100% compliant. But in this one, in this case, you know, our advice has been shelter at home, stay 6 feet away, wash your hands. And you know what? We know that the overwhelming majority of people have done that. And we know it because the curve has flattened. As we start talking about opening up society, I come back to a point we made earlier. We are at a crossroads. It's kind of like that was a Robert Frost poem about being in the woods in a snowy evening, and which way do I go? Do I take the road less traveled, or do I take the other path? Well, the other path is let's run back out and go to the restaurants, let's go to the bars. That's probably not the right path. We're going to have to take the path less traveled, the one where we don't do things like we used to do, and we can't reopen right away. We need to support our businesses. We need to support folks getting back to work. And we need to stay safe. And that's going to be about social distancing and really physical distancing, because social distancing is now less, right? Because you're going back out into society. It's about physical distancing. So personal responsibility in this crisis will never be more important than it is on the days ahead. Stay with us. Stay at it. You've done great. Keep it up. We'll talk to you next week. Have a great weekend.